Hello, and welcome to our series, Meet the College of Social Work faculty, where we highlight the incredible educators who shape our community and inspire our students every day. Today, we have with us Margaret Janse von Rensburg, an assistant professor here in the College of Social Work. Margaret, please introduce us to yourself.
Hi, everyone. My name is Margaret Janse von Rensburg, and I am an assistant professor in the College of Social Work, as Alexis just said. I joined the college in August of 2025, and I actually come from Toronto, Canada, and was most recently in Ottawa, Canada.
Thank you for sharing, and welcome to the college. So, when you think about social work, what is social work to you?
Social work to me, I borrow this, I think, from the NASW, that it's really about creating and sustaining healthy communities. What I really like about social work in opposition to other professions is that we really think about linking the personal with the political. And so what that really means is thinking about individual issues as really influenced by broader structural issues. So that might be someone's life history. It may be something that's going on to do with finances or politics. But really, it's thinking about individual issues not being just personal deficit, but actually influenced by communities. And it also, on the other hand, thinking about strength and resilience as not only individual, but also as being strengthened by community and other forces in society.
Thank you so much for sharing that systems perspective, as well as the importance of viewing a person or a situation in a holistic manner to ensure that we, as social workers, continue to strengthen our communities. So, what drew you to social work?
So my undergraduate degree actually is in archaeology and medieval studies,
Interesting.
which is totally different than social work. I like to make the joke that I decided to study the living, not the dead. But what really brought me into social work was I had a lot of really helpful social workers in my own life. So during my undergraduate degree, I actually took a break because I had my own issues. I had a chronic eating disorder at the time and had to withdraw. And I was able to finish my undergrad degree, but I had a lot of social workers who really helped me. And so I decided I wanted their life. I wanted to not only find that kind of way to help other people, which I found really helped myself, but also have that positive impact on other people.
You were doing that. Thank you. So, how do you balance ethical standards and personal values?
So for me, social work isn't only a profession. I really think about social work education as identity development. And so when I think about ethical standards, I actually think that a lot of them resonate with those who go into social work as personal values. I think that sometimes we'll have times when our clients make decisions that we don't necessarily agree with, or that there may be a policy that we are upholding that we wouldn't choose to do that in our own life. So if we think about some kind of more political issues like gun rights or abortion, that might not be something that I choose in my own life. However, restricting other people's choices or their social justice in those ways, that wouldn't be my job to do that because of my own personal values.
Right, right. It really speaks to how social work focuses on autonomy and sense of choice when it comes to individuals and their decisions. So thank you for sharing that. As a social work educator, what do you do for self-care?
So I'm also a neurodivergent person, and neurodivergent people often have special interests. So my special interest is swimming. I once swam every day for a year just because I find the rhythm really calming. I can think through things. It's also a great distraction, and it's a way that I meet people. Um, the other thing about self-care that I will add, though, is that sometimes self-care isn't just these luxuries that that we are so privileged to be able to. So here in Columbia, I'm able to access a lovely pool at the Charles Drew Wellness Center. And sometimes we're in a space where we can't always access that. So I sometimes like to reframe my self-care as thinking about future Margaret. So doing laundry or cleaning so that I can wake up tomorrow morning and not feel stressed and have clean clothes to wear and not have that on my mind all the time.
That is very true. Not all self-care is about luxury. I love that point. This week in Social Work 201, we are talking about physical, cognitive, and developmental challenges. Margaret, your work is around autism and neurodivergence. As an individual who openly shares their ADHD diagnosis, are there moments or experiences that have helped you better understand your neurodivergence, and how did they influence your work in social justice or disability advocacy?
Thanks. So I just want to give some quick, I guess, definitions. So neurodiversity really is the idea that neurological differences are natural variations. And it's kind of like thinking about biological diversity. Neurodivergence refers to the individuals whose neurological development might be different. So ADHD, along with autism and other neurodevelopmental disorders, they're not necessarily mental health issues that come up, even though they are in the DSM. They are developmental disorders. So they are throughout your childhood and into adulthood. I wasn't diagnosed with ADHD until I was an adult, but I always did feel different, and I did miss some developmental milestones, was a little bit socially awkward, and I also do have this history of an eating disorder that helped me to understand what behavioral therapy could be like as a participant, I guess, or a client. So that really helped me to, or inspired me to go into my research around autism. Mm-hmm. And I think it's that shared experience of knowing that I'm a little different, having a family issue. So often autism, ADHD, and eating disorders are all kind of issues that are perceived as an issue within a family system, and also the experiences of going through a behavioral therapy, and that can have some benefits and some drawbacks.
Next question. Many social workers will encounter individuals with ADHD and autism. What do you think social workers overlook about these conditions?
So I brought up a little bit before, but often ADHD and autism, because they show up with other developmental disorders in the Diagnostic and Statistical Manual of Mental Disorders, the DSM, they will get conflated with a mental health disorder. So I think that it's important to know that autistic and neurodivergent people, we can actually have mental health issues that are compounded with these. I think also thinking about, so my dissertation research was really about the mental health strategies and approaches that were used for autistic and adults by professionals. And something that really was brought up by a lot of the participants was using an individualized approach. So remembering that no two clients are the same, whether they're neurodivergent or not. And so there's no cookie cutter or standardized approach that we can take. We may draw upon different modalities or therapies, but a good generalist social work education should give you the skills to be able to work with a neurodivergent person. And so that kind of leads into my next point, which is that social workers often, and among other professions, we often think that we need specialty education to be able to work with neurodivergent folks. And a lot of neurodivergent folks don't even know that they're neurodivergent. And so being comfortable about learning and being uncomfortable and asking questions and being client-centered is enough to be able to know that you can work with neurodivergent and autistic folks in your practice. And also just being able to lean on supervision, lean on critical self-reflection to be able to know when you've kind of met that limit. Okay, maybe I do need to refer out to specialty behavioral therapy, or maybe I need to refer out to a diagnostic team.
So speaking of your dissertation, are there mental health practices or approaches such as trauma-informed practices, peer support, community-based services that you believe work especially well with neurodivergent clients?
Thank you.
You're welcome.
So yeah, my dissertation research really underscored the necessity of this individualized approach. But something else that is becoming more prevalent in the research and was also brought up by a lot of the participants was taking this neurodivergent affirming approach, or sometimes it's called neuroaffirming or neuro-inclusive. But these are really building upon a person's strengths and not seeing autism and neurodivergence as a deficit. One of the participants in my research really called it building on someone's column B criteria. So in autism, there's a column A, which is some of the social, quote unquote, deficits that people may present within autism. And the column B is around restricted and repetitive interests. And so I brought up my special interest in swimming. And so a great mental health practice for me is to build upon that and love swimming. And so building upon someone's strengths, building upon someone's interests, and using that in ways that can really help someone's and promote someone's mental health really came up as a good neuroaffirming strategy.
How can therapy be redesigned to be more aligned with neurodiversity values?
So I am not a therapist.
Okay.
However, a lot of the strategies that were brought up in my dissertation research were really about that neuroaffirming approach. So really building upon someone's strengths. What I also want to think about, though, is that we can have great therapeutic settings, but if our environments are not more inclusive, if our world doesn't change to be more inclusive and supportive of autistic and neurodivergent folks, then we can do all the therapy in the world, and it will make very little differences. So as social workers, even when we're in clinical settings, thinking about connecting that our work to more structural changes, doing some advocacy work, doing some education to workplaces and to societal structures, so that we can have a more inclusive environment where people maybe they won't need social workers for therapeutic purposes.
I appreciate you sharing how therapeutic spaces, clinical settings, and society in general can and should support neurodivergent individuals. And that leads me to my next question. What changes in universities or workplaces would improve the experience of neurodivergent students or colleagues?
So I think that what's lovely about changing the environment to be more inclusive for neurodivergent folks is that it often makes the environments more inclusive for people who are not neurodivergent or people who can't access a diagnosis. Specifically for autism and neurodivergence, I think having open And openly autistic and neurodivergent faculty, just to have that representation, because it is often hidden or masked, would be a really nice asset for making especially university environments more inclusive. Institutions also might benefit from honoring like self-identification for neurodivergence and autism. It can be really challenging as an instructor for me to be able to accommodate certain needs without a diagnosis. And so finding alternatives, especially when we know that being able to get or access a diagnosis can be particularly challenging, especially for our students in the College of Social Work. Something that I like to practice is something called an access check-in. So rather than thinking about accommodations, access check-ins really think about, okay, how do I need to change the learning environment or change the setting to be able to make this more inclusive of you? Because what can be really challenging for being able to implement some strategies is being able to be universally accessible. And that can be almost impossible to be universally accessible, because accommodating for one individual's need might actually detract from somebody else's. So being able to do those access check-ins can help, as well as like getting some transcription support or AI note-taking in a classroom environment can be really helpful. As well as cultures that can support flexibility or reduce unnecessary barriers can be really helpful. So just having an open environment where people can ask and know what they can ask. So often we'll call this the hidden curriculum when it comes to neurodivergence. But when you're going to a meeting, knowing what to expect. Oh, is that meeting actually about your support, or is it to check if you need something specific? So just being having that kind of like more open transparency can be really helpful.
Thank you so much for that information. It definitely lends to the importance of having an inclusive environment in the classroom, outside of the classroom, within field placements, within social work agencies and organizations. And it's vital to have transparency, inclusivity, where you're able to create a brave, safe space for students to actively engage in their learning. So thank you. I appreciate how you reframed an accessibility check-in to an access check-in. Thank you for that. This concludes our interview with Margaret. We appreciate you being here with us and sharing a bit about yourself with the community.